That's
quickly
a
fade off.
ticking time bomb for you.
Yeah.
Yeah, it's a matter of seconds and minutes.
He's 64, comes in to see me as a new patient.
Screening your mental health is part of your physical exam.
Do you know I did an EKG? And guess what it showed? He had atrial fibrillation.
On your vascular system, the blood vessels are no longer as, easily compliant, where they can contract and expand easily as when you were a younger person.
Welcome to your daily health briefing. I'm Dr. Albert Takem. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. Most patients believe an annual physical is simply about checking boxes. Blood pressure, lab work, quick exam, boom, I'm done. See you next year. But a properly performed preventive physical exam can identify disease years before the symptoms appear. Today, I am joined by Dr. Joan Ngembus to break down what a high-level preventive physical should actually accomplish and why the traditional model often misses the biggest long-term health risks. Welcome to the show, Dr. Ngembus.
Thank you very much, Dr. Takem. I'm pleased to be here.
So let me give you an example of a patient who exemplified this story or this introduction. So I've got this guy he's 64, comes in to see me as a new patient. And he tells me that he's here just for his physical because every year around his birthday, he goes for his physical. And so we do, basic blood work. He's like, well, I'm just here for my physical, there's nothing else going on. So the past year, you've not had any issues? Like, no, nothing. Every now and then I feel some, palpitations, like my heart is beating fast, but that's about it. I'm fine. Do you know I did an EKG? And guess what it showed? He had atrial fibrillation. So I wanted us to talk today about the situation within the broader context of a properly performed physical. And by the way, on the physical examination, he had an irregular rhythm, and that prompted the EKG.
Mm-hmm.
So why do you think these situations happen? What is the disconnect that patients have between what they expect from a physical and how we primary care doctors view a physical?
Yes, so that's a good thing. I always like physical exams. So patients come in, what they know what to do is just like, my insurance told me I have to do my yearly physical, which for me is usually my blood work and then the physical exam, and then I'm done with. So what I let them understand is the physical is not just about blood work and the physical exam. It encompasses you as a person, right? We need to know your daily activities. They forget to understand that screening your mental health is part of your physical exam. When you get to talk to patients on that day, you know what, doc, I have been so stressed at work. I lost my partner, I lost this, and they are emotionally drained. And then you kind of figure out, nowadays I've not been able to get out of bed as I used to. I would be lazing around. I don't have interest. Which are those signs of depression the patient did not acknowledge it to be what it is. And so we tend to deep dive more into that patient holistically, not just obtaining blood work and just doing a physical exam to see if I can identify something. And so there are a lot of screenings too that we have to do in a physical exam. Screening for cancer in a male, screening for prostate cancer, or screening for colon cancer, making sure they are aware of this part of the examinations. Vaccines are part of your physical exams. Every year, they roll out the vaccines, flu shot, COVID shot, RSV. We have to be up to date with those things. So we let them know those are still part of your physical, right? And also encouraging them, making sure to understand that how active are they in their daily activities? Are they doing any form of exercise? Because the cardiovascular risk is always high as we get older. So are they doing...
about that point, the cardiovascular risk, let's start with that.
Yeah.
Because I want us to break the different components of a physical.
Sure.
Right? The cardiometabolic risk scoring. Mm-hmm. Why do we do that, or why is it important in a physical?
Yes, it is. It's one of the most important part of physical, because that's where we try to, catch up things that might, what I say is things like high blood pressure, where we usually call it the silent killer. right? If we do not identify things like high blood pressure early on, they have a lot of consequences if we do not identify that. Stroke is one big one. And we see a lot of people on dialysis having kidney failure because they've been having underlying uncontrolled blood pressure. So cardiovascular risk as we get older, it's some of the things we need to pay more attention. Your vascular system, the blood vessels are no longer as, easily compliant where they can contract and expand easily as when you were a younger person. Now they're a little bit more stiff because of the age, more pressure going through those blood vessels. So your blood pressure tends to vary a little bit when we get older, especially if somebody had a genetic component, a family member had blood pressure issues. So we need to pay more attention. As we get older, the metabolism is a little bit slower. Some people have a hard time losing 1 or 2 pounds. They could do that when they were in their 20s. Now at the age of 65, you need a month to be able to get 1 pound away. And we all know that weight loss or maintaining your normal weight according to your height, which is the BMI, is one really critical part of a healthy human being. So we pay attention to those things most especially because the complications are really detrimental to a patient when they suffer from a stroke or heart attack.
Okay, so that leads me to piggyback on something you just said earlier, the body mass index. And, from that, let's talk about lifestyle and psychosocial risk evaluation involved in the physical. How do we do that?
Yes. So I try to turn to my patients when we look at your weight according to your height, which gives us the body mass index from the calculation. We want it to be between 19 and 25. That will be the optimal numbers to be at. Now, I try to address with them what are some of the things they like to eat, right? What do you eat in a day? Are you aware of the calorie content of what you are eating? Are you aware of how much cholesterol could be in the things that you eat? That's where I give them some of the guidance to make sure that if you are out of the range, especially most of the times people are above the range. So I try to guide you on what you're supposed to be aware of, balanced diet, what you eat to make sure that you stay within that range, and especially making sure that you're doing exercises. Now, it's common for my patients to say, you know what, doc, at work, I'll be walking. I just walk from here to there and be walking up and down. I'm like, that's good. It's good for your cardiovascular system. It helps to improve your blood flow through your system. But also you need a little bit of a push, which is the jogging or the running, because it then improves that compliance of your blood vessels back again. In that way, the blood pressure tends to improve. And in that way, you're able to lose a little bit of pounds doing those exercises, which is what we really recommend. You get benefits from your joints. Joints don't hurt anymore as they used to because the more you sit and you don't use your joints, the more they wear and tear. So you want to get those joints active. And so I really recommend that they incorporate that part into their lifestyle.
Now, how about preventive screening? How does that factor into the annual physical?
The preventive screening, the guidelines that we have from the Cardiology Association guidelines, we also have cancer guidelines where we screen for cancer such as colon cancer. Nowadays it's done at the age of 45 with a family member who had a colon cancer. Then the risk is even higher for a relative, immediate relative. So we can do it much earlier than the age where the person had the cancer. So we always adhere to the cancer screening guidelines. Things like prostate cancer for men. We also have lung cancer screening. It is what most people forget because they be smoking cigarettes and they forget to know, we need to screen for lung cancers, which is done at the age of 50, especially if you've had more than 30 pack years of smoking.
How about the AAA screening?
AAA screening is also recommended, especially in men.
What's AAA, by the way?
Yes, AAA is abdominal aortic aneurysm, right? Which simply says expansion or a weakness in your blood vessels, the main one in the abdomen. And so we want to make sure if there's any concerns of that. That happens usually when patient smokes in smokers. There's irritation in the blood vessels that makes those linings a little bit weak. And because it's the bigger part of the blood vessels in the system, they are at risk of injury if those vessels are weak. So we want to screen for those patients, and it's usually done in men when they are above 65 years. At least one time you have that screening to make sure that you do not have a very weak vessel.
Because if you have one and it ruptures, it could be very quickly fatal.
That's a ticking time bomb for you.
Yeah.
It's a matter of seconds and minutes.
How about family history? Family history interpretation. I know you touched a little bit on that when you mentioned screening for colon cancer. How does family history inform?
Yes, family history plays a significant role because when I see younger patients nowadays, I see that a lot. They come in at the age of 30s and we're already seeing some high elevated blood pressure to high blood pressure. And we're like, oh, Is there somebody in the family? They're like, yeah, my dad and my mom. So we have that genetic component of blood pressure. So family history plays a huge role because we can closely monitor you. Even if your blood pressure is not in the high blood pressure range, but it's in the elevated pressure range, then we know how to stratify your risks more closely and guide you into making sure that you can do the things to prevent your blood pressure from being in the high blood pressure range, which boils down to the dieting and the exercises, which will help to improve that blood pressure. Another person might have a family history of diabetes, and we try to help guide them depending on other symptoms we find. If you're overweight, you're having a sedentary lifestyle, then with the risk of a family history of diabetes, then your risk is a little bit higher of getting diabetes. And so we try to counsel you, making sure that you live a healthy lifestyle to be able to prevent those diseases.
Is there anyone who can do a preventive care visit better than your primary care physician?
I do not think so. I think the primary care would do it better because they go into detail in addressing everything. Specialists would only address most of the times what you came in for, right? The primary care would have more time to sweet you and discuss all the aspects of your life to be able to do all those preventive stuff. I think the primary care doctor is the best one to do that for you.
And that's a little bit, preventive care visits is not something that happens in isolation or in a vacuum.
No.
Generally, you have to do a physical on someone you've been seeing every 3 months or every 6 months. So you already have information about that person.
That's right.
So it's even more the reason why your primary care physician should do your physical, and you should have an established and ongoing relationship with one.
That's right.
I'm always perplexed when patients go to like an urgent care for their primary care. The name of the place is an urgent care.
And
right?
And I really do feel bad because you're taking up space and waiting, taking up the time for the people who really need that urgent visit, right? But you go there first and they want to see you. But somebody who really needs the urgent visits tend to sit and suffer and wait a little bit longer. And so I really urge patients to know the difference, what primary care does and what urgent care does and what the emergency department does. Because some people like, I have a cough today and I have to go to the emergency department. So they need to understand the differences of how to escalate the care. And we always recommend them before you go see the ER, make sure your primary care doctor is aware that you are going through something and they will help you guide you where you get the best care at that time.
So let's go back to my patient, the one I just diagnosed the episode of atrial fibrillation.
Yes.
Imagine he hadn't come for a physical, or we had just done his labs as he insisted we do because he wanted to get out of there. What do you think would have happened to him 5 years from today? What does the data say?
Yeah, so for patients that are having atrial fibrillation like that, or especially unknown, the risk about atrial fibrillation is that, from listeners out there, it's like irregular heart rhythm. And because your heart rhythm is irregular, you are at risk of bleeding blood clots because part of the heart, which is called the atrium, is not able to give it a good pump or a good squeeze the way it's supposed to. And because you do not have a good squeeze, your risk of getting a blood clot in that area is high. What that means for us professionals is that blood clot, when it leaves the heart, it goes to areas, especially to the brain, because that's where the blood flows, to the brain or even other parts of the body, but the brain most especially. And when that happens and it closes up a vessel in your brain, there you go, you have a stroke. And so that's the reason why we want to make sure that those symptoms are caught earlier. You're put on blood thinners to make sure your blood remains thin, your risk of forming clots are low, and so you have a better life even being on your medications going forward.
I think we've covered a whole lot of ground here, Dr. Joan.
Thank you very much.
Thanks for joining me on this episode.
My pleasure.
So I guess if I can recap for the patients, basically the physical is a very important test because patients deserve a well-performed physical. Secondly, it relies a lot on a strong relationship and a strong allyship between the patient and their primary care doctor. And thirdly, the primary care physician pretty much serves as a quarterback of the situation. I don't know if you watch football, but something along those lines. And last but not least, early detection saves lives and improves life expectancy and especially quality.
That's right.
This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Takem, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.